I have a friend who's out in LA right now on a vacation, and she was hiking outside. It's beautiful there, you know, if you want to hike outside. And she said most of the people were wearing masks outside while they're hiking. It's like, hello, you don't need, even my brother-in-law, who I love, we saw him over the holiday, and he was offering us these little things that you can put under your mask that make it easier to breathe. I don't know, it's like these little plastic things. And I said, Ken, I don't want to make the mask more user-friendly. I want the mask off. That's my goal. I refuse to submit to fashion or comfort or anything else with these masks in the meantime. I want it off my face, and I want it off my kids' faces. And I just don't think, short of moving or politics, I'm going to be able to convince these heads of school out here that it's the right thing to do. What do you make of the masking?
I mean, I think we have vastly oversold masking as a solution to this epidemic, as a solution to controlling the spread of the disease. At the beginning of the epidemic, there were I think like dozens of randomized studies with the flu, randomized studies conducted in community settings, even in hospital settings, where they showed very little efficacy against control of viral spread. And back then it was the flu, right? That they'd done these randomized studies, dozens of them. Since COVID, there have been 2 randomized studies, and both have found either small or no effect in terms of the efficacy of masking and protecting against disease spread, both protecting you and protecting others. Very, very low efficacy. When you have public health going so foursquare behind a intervention universally adopted, pushing it for universally adopted, with such low levels of efficacy, it's going to breed distrust. And especially when you're told, well, it's not that problematic to wear. It's like, you know, there's no cost to wearing it. There's no harm. Well, anyone, I mean, truly, is there anyone that can honestly say that they prefer wearing a mask? If they like, I mean, it's okay. It's in terms of like, there's no discomfort, no difficulty breathing at all. I just don't believe that that's true. I mean, I've worn masks lots, and I don't like it. I mean, I don't think most people wearing it actually honestly can say they like it. It would be reasonable in some settings to wear a mask, like if you're a surgeon and you're managing a patient with a surgical field in front of you, and you don't want to put, you know, bacteria into the field or something. That makes sense to wear a mask in those kind of settings. But at the population level, 2-year-olds, toddlers wearing masks, the United States is unique in this, by the way. Only the CDC says 2 to 5-year-olds should wear masks. Even the World Health Organization doesn't say that.
Yeah. And now they're talking about out in LA mandating the N95 masks. I mean, the ones that really suck your face. I mean, like, that's the complete coverage that we get through with sort of the cloth masks, which are as loose and as comfortable as possible with my kids. But N95, you got to be kidding, man, on all the children. And Fauci saying we're never going to be able to take the masks off on air travel. It's like, you will not be in charge forever, Fauci. You will retire with your okay, so right now he makes $434,312 a year. Unbelievable. And he'll be retiring with at least $350,000 per year in retirement. But you enjoy that, Dr. Fauci. And you realize that at some point you will not be running public health policy, and you and Pete Buttigieg will not be able to keep your hands over our mouths for every domestic flight. There will be a return to order and reason at some point, because the public has the final say.